So before we'll have a conversation with Dr. Vida, like we said, tomorrow, Thursday, April 11th, 2024 is World Parkinson Day.
Yeah.
And we'll be having an interesting conversation with Doc. But then let's take a look at this video, which tells us about the disease. And then when we come back, we'll interact with Doc.
Nenye yade so eka wa ekire se obi abo obi a ana se obi aye obibi enti sa na ye yade a ewo ho mesre ankran no mo ka bi ebem so mu yade ya omu hu ye mobo no mu tie sufre. Okay, so that was the Nidasol Foundation, and they were telling us about the Parkinson's disease, because tomorrow we are creating more awareness, and every time we emphasize on these things to the general public. But then tomorrow is actually the day that is the World Parkinson's Disease Day, and so we are going to talk to Dr. Vida. I know she's joined us here before, but today she's joined us via Zoom. She's a neurologist and also a senior physician at the Okonfo Anochi Teaching Hospital, aka you said what? G. Okay. Good morning, Doc. Hello, Doc. Can you hear me? Can you unmute yourself?
Okay. Hello. Good morning.
Hi.
Good morning. We can finally hear you.
How are you?
We are good.
Okay.
Yourself?
I'm good, by God's grace.
Okay.
Fantastic.
How is everything? How's work? How's the foundation? Even before we start talking about the disease and the day, how's everything going?
By God's grace, we are growing in leaps and bounds. We are getting more people interested in learning about the disease, and we are getting more support since the last time I came to the studio. So
yes,
it's good.
yes. That's very good. But for someone hearing this disease for the first time, Doc, take us through what exactly is considered as Parkinson's disease. Most people just know it as like a brain issue, and it affects certain nervous system here or there. But then just briefly tell us about the disease.
All right. So thank you very much. Parkinson's disease is a neurodegenerative disease, meaning that it's a disease that affects the brain as a result of changes in the brain. For Parkinson's disease, there's a part of the brain that we call the basal ganglia, which helps to control our movement. And what happens in Parkinson's disease is that for some reason, the neurons or the cells that help you to move, they require a chemical called dopamine. And for some reason, these cells die. So the dopamine is not available for you to move. So patients tend to become very stiff and have tremors in the hands. Usually starts on one side of the body and then progresses to the other side of the body. And sometimes they have postural instability. Yes, and then they are very slow. They are very, very slow. So those are the movement problems that this disease causes. But there are other things that do not have to do with movement, such as anxiety, depression, nightmares, constipation. These are all parts of Parkinson's disease.
When someone is affected with this, what is the life expectation of that person? Hello, Doc.
So usually for Parkinson's disease, hello, can you hear me?
Yes, I can hear you. Kindly continue.
So as I was saying, it's a progressive neurodegenerative disease. So it means that it gets worse over the years.
Okay.
And it affects people differently. People progress differently. Somebody may be very slow, may not even have tremors. Other people have tremors, but may be a bit slow and may progress over maybe 15 to 20 years before they become advanced. Somebody can become advanced in 10 years or 5 years. So we cannot predict how a patient progresses, but because the disease affects individuals differently.
Okay.
All right. Doc, I also want to understand the awareness for the ordinary Ghanaian to know what this disease is. Do you think that generally we have been doing so much to drum that home?
No, the awareness, the knowledge of the disease is very low in Ghana, and people usually assume that it usually affects people above the age of 55, 60. So when they see somebody like that slow, they tend to attribute it to aging. And then because it starts on one side of the body, sometimes it's misdiagnosed as stroke. And so there's a very low knowledge base, and we are not doing enough, we know. But you are helping us with this program as well to disseminate the information. We've created booklets that we share to communities. We are doing a lot of community work to get people to understand the disease and also to reduce the stigma patients who have Parkinson's disease face. So definitely there's so much work to be done.
Okay, but in recent times, when it comes to diseases like this, you mentioned 50 to 60, but a lot of times lately, you have the age reducing because you find some youth, suffering from diseases that we thought were for older people and all of that. How is there even a way that as we're growing, we could put our lives in a way that we may not necessarily have this, or no matter what, it may come to you one way or the other?
So just let me expand a bit on what we think the cause is. So for now, we do not know what actually causes these neurons to die off. And so we cannot predict what you do that will cause it. We do have some percentage of patients having the disease as a result of genetic, something in their genetic makeup.
Okay.
And they tend to come earlier with the symptoms. Now, even in Ghana, we are getting people in their 30s and 40s presenting with Parkinson's disease. And so we need to understand what in our environment are we exposed to that is putting us at risk, which emphasizes the role of researching into this disease to find out how and what puts us at risk. But to answer your question, anything that is good for the brain will protect you from diseases of the brain. So eating a balanced diet, exercising, enough sleep, that would keep your brain active and would protect you generally against Parkinson's disease and other diseases. But we do not know what to tell you to prevent the disease. But if you have a genetic risk, yes. So if there's a genetic risk in your family line, you may have a higher risk of developing the disease. And we do not have those genetic testing easily available. You can even have the risk and may never have the disease. So it's not as straightforward as it is. But generally, if you want to prevent disease of the brain, you have to keep your brain healthy.
Yeah. Okay, Doc, we do know that the significance of this awareness tomorrow is to let people understand, not people to judge, stop the whole stigmatization, and also know more about these diseases and bring out, like, they should have less misconception about the disease. But then, aside that, are there any specific goals or objective for tomorrow's World Parkinson Day?
All right, so thank you very much. Every April is designated worldwide as a Parkinson's Disease Awareness Month. And so for us in Ghana, we have a sit to stand challenge that we started. It's on social media that anybody can join. You basically stretch your hands and get up from the sitting position, you stand several seconds and you post it online. The reason why we have this challenge is also to let people understand that this is one of the most difficult things that patients with Parkinson's disease, and they find it difficult to do, getting up even from the sitting position. And we want to let them understand that they are not alone in their fight. And so we would love the public to join our Sit to Stand challenge. And I think that would also raise awareness and stimulate the conversation about Parkinson's disease in the country. And also we have, we want to reduce stigma, but want families who have been affected with Parkinson's disease to understand that the journey, we know it is difficult, but we want the stakeholders to help us make their journey a bit easier. So for patients with Parkinson's disease, they need care from various disciplines, like they need a nurse, they need a pharmacist, they need a physiotherapist, they need a nutritionist, need a speech and language therapist because sometimes they have problems with swallowing. So even though we are educating the public, we are also trying to create awareness to most of our stakeholders to help patients get access to these multidisciplinary management, so that it's not just about having medication, but having access to all the other disciplines, which makes the living with the disease easier.
Okay, thank you very much, Dr. Vida, for educating us this morning. So we've been speaking to Dr. Vida Obese, who is a neurologist and also a senior physician specialist at the Okonfanoji Teaching Hospital, aka G. Yeah, because tomorrow is World Parkinson's Disease, and like she said, we are creating more awareness, educating the public on what exactly the disease is, and lessen the misconception and rather go out and support these people. Okay.
Very important, very, very important that.